Welcome, Alana. We missed you. Poor Alana was sitting out in the main room by herself for a little while. All right, we'll keep going. So now where we've done this bit, so we are at now sort of looking more at the evaluation theory content side that hopefully that you'll then apply to the sort of major project within this unit, but also then the program that you place on with your placement. Okay, so evaluation. Evaluation is an interesting aspect of public health, and you know, you might listen to this quite theoretically based unit today or content today and think, oh God, well, I'm in the wrong direction. But if you are heading into public health, it really is a big push to do more in the evaluation space. And in the House of Lords in the UK, there was actually a bill passed that said we need to start evaluating public health and health promotion initiatives because we don't know enough about their outcomes. And I think it is quite a big downfall as a profession that hasn't been done effectively over the last sort of 20 years within public health space, is that we've been really focused on developing interventions and looking at behaviour change and a whole lot of intervention, but they're not really monitoring well the outcomes. Are they effective or aren't they effective? And I think from a public health perspective, and this is definitely backed up in the literature as well, that we're at a turning point now where, you know, the rates of non-communicable diseases are still going up rapidly. And we really need to take a critical look at what we've been doing over the past 20 years as to why that may not be having the biggest effect that we want it to do. And to do that, we need to be more effective in our evaluation and also build evaluation into our programs more and whatnot. And it's no fault of how what has been happening in a lot of these spaces, but often our evaluation is left at the end and there is no money. Okay, so often funding has run out and people tend to move on to the next thing or the next grant or the next stage of things, and that important evaluation process had been and not been proceeded with. The tide is turning though, and a lot of grants and funding bodies now require you to provide an evaluation of that program to receive parts of that funding as well. So we really are seeing a change in this space, and if you are moving into the field, particularly around intervention development and running interventions, then you will definitely have this as a big part of your work and important. And if you're going into government, then the evaluation report that's required a lot of this at the end of a lot of their public health initiatives is an absolute cornerstone to a lot of the work that you'll be doing. So that's why I've built it into this unit, as it's an important skill set for you to have. And I was saying to Heather before that, you know, by learning these skills, that's what you need to say that you've got when you're going on your CV. Be confident in what you're learning. You may not have, you know, a huge amount of practical experience, but also if you're applying for a graduate level program, then they should be mindful that you're not able to have, but you do have that skill set still, okay? So why evaluate? Well, you know, we need to monitor progress. We need to know we are achieving those health outcomes or those goals that we want. Is it a decrease in something? Is it an increase in something? What is it? And the goals can be large or they can be very small. So, but we need to know, is there a change? Is it effective? Maybe not. We need to determine whether program components are producing desired progress, you know. So it's no point continuing with a program if it's not actually progressing on the outcomes, okay? So not only do we need to keep evaluation at the end, which it traditionally has been, we're going to look at this a little bit more, but we also need to start building it in as checkpoints into the interventions that we're delivering or initiatives that we're delivering. So towards the goal, oh, sorry, I've done that twice, that one. That wasn't very effective of me. There you go. To determine whether program components are producing the desired outcomes, okay? And again, so we want to know, is there it could be something like a biomarker. Are we seeing a decrease in blood sugar levels in a certain population if we're developing a diabetes intervention? What is the desired progress? And we also want to be able to look between groups, okay? So it's very important to look at, okay, particularly in Australia, and this is particularly relevant around Indigenous health, okay? So we need to look at, there's been a lot of rollout of interventions, particularly in the Indigenous health space within Australia, and a lot of them have failed, and a lot of them haven't been evaluated effectively. And we need to be able to evaluate them to see if they are, you know, either closing those health gaps or there's still a huge gap within those health outcomes and those disease outcomes. So it's incredibly important to keep a track on those things, to compare groups as well. Justify the need for further funding and support, which is very important. And you see this a lot in public health, and unfortunately it comes back to politics. And like I always say, that health is not, no matter where you sit from a politics point of view, if you're going into public health, your work will be affected by the politics at that time, okay? So depending on where funding is put, it always comes back to a political decision, and unfortunately that public health is tied hugely to that. And if you're evaluating something and you want to see, you know, it might show a slow increase in outcomes, or it might show a slight improvement, but you need more money, and you need to go back for another grant, then that data is crucial to really push the longevity of that project. And we know that the longer a project can be implemented successfully and sustainably, then the longer that health outcome will be sustained as well. And also quality improvement. So again, it comes back to that longevity and sustainability of these interventions. If the quality is not there and the quality checks are not there, you're not going to find improvement. And that unfortunately has been shown with retrospective evaluation of some of the Indigenous health. And you see the outcomes of that on the news as well, you know, with overburdened staff and time and all those squash often when funding is short can compromise quality of an intervention. I think now they say the recommended, when you're building a funding application or grant application, you need to now allow at least 10% of that funding to be purely dedicated to evaluation, where often it used to just be lopped off and not included at all. But that's sort of the golden rule of thumb, that however much money you're applying for, 10% of that needs to be dedicated to evaluation. So that's why. And now to sort of look at the different types of evaluation. And this comes back to what we're talking about, how it's not just at the end of the project like it more traditionally was. So now it's really broken into 3 types of evaluation. A formative evaluation process is actually, and again this is being seen as important more and more, and that's an evaluation prior to a program being run. Okay, so is there even a need there? You know, are you designing a program that's absolutely going to fail because there's not actually a need or an ownership by the community? And that's what we term formative evaluation. So you assess a program or implementation and outcomes prior to it being taken. Okay, so and you might have a whole lot of objectives for the program. You go and run a survey within the community. If we're looking at Indigenous health outcomes again, what the government might be wanting to improve, say attendance at school. If you go and talk to the community, that might not be important for them. For them, it might be access to more fresh fruit and vegetables. Okay, so looking at what is actually needed prior in formative evaluation can really set the trajectory of if the program's going to be successful or not. And then process evaluation. I mean, they're a bit, the names sort of give it away, or intuitive in terms of formative meaning former, process meaning during. Okay, so this is really that checkpoint of quality throughout, and it's really good when you're writing a grant or writing a program timeline that you do those point of evaluation. So looking maybe 1 year in, what are the outcomes? Has there been an improvement? Hasn't there been improvement? And it doesn't also necessarily need to be that process evaluation doesn't necessarily need to be specific health outcome evaluation, but it could also be just, was the material understood by the people that were reading it, okay? Was the app too hard to use? Was the information too complicated? So it's not necessarily, a process evaluation is not necessarily always looking specifically at those outcomes that we're trying to improve, health outcomes, but more that quality and delivery of the intervention. And it's a time, and if you're getting feedback that's saying that's not effective or the quality of delivery is not there, then that's a time for you to reflect within the program and change those things. Then obviously the more traditional or final sort of evaluation is the summative evaluation, and that's where we really want to assess, okay, what were the outcomes? Were they achieved? What was the impact of the intervention? Did we see a huge decrease in a particular health outcome? So we might have seen, a decrease in the blood sugar levels within a population, or we might see an increase in the uptake of a health behaviour. So you might see the increase of fresh fruit and vegetables, or you might see the intake or uptake of more exercise, or you might see, if we're looking back at the school program, you might see more children actually at school for longer periods of time, okay? So obviously this occurs after the project has been implemented, and it really is now what is becoming a cornerstone part of public health practice. It's then broken down into a couple of types of evaluations. So summation evaluation then becomes looking specifically at those outcomes, and they really relate back to the program objectives at the start, okay? So they assess those long-term goals, those long-term project or program goals, and have they been met? So did you see a greater adherence to a certain type of health behaviour? Did you see a decrease in X or Y? And also, interestingly enough too, economic outcomes. So health, so you could look more big picture and see from an economic perspective, was there greater amount of people in employment because they were suffering less chronic pain, and what was the knock-on economic effect of that? If health economics is your jam, it's very interesting. If you ever want to if you're in the economic space as well, it's a really interesting space to get into. And impact evaluation also looks at the exact impact of the program, okay? So how effective was it within that specific community, and what was the impact, okay? So the impact might be not just a measure of how many children went to school, but then how many children went to school and stayed there until, year 12, or were able to then have a tertiary entrance, okay? So, and these can often be long-term, like longitudinal impacts as well that need to be monitored, and often they can be unintended. So sometimes a program might go in hoping to change one health outcome, and it might change another. So it might, you might be wanting to increase exercise, but you then also increase the mental wellness within that community, or interconnectedness. So you might be just looking at trying to improve a chronic disease, but you connect a whole lot of people within that chronic disease diagnosis, and then they've got that knock-on effect of their interconnectedness, and they've reduced their social isolation, so then they're increasing their mental health and wellness as well. So capturing those in an impact evaluation is also very important for a program. It's quite theory heavy today, I do apologise, but we'll push on a little bit more, and then we'll have a breakout for a bit of a worked example. So we're also going to look at how this then applies in terms of evaluation framework. So one that was probably, like I said, evaluation it's not new, but it's something that's being emphasized as more and more important. Probably the most original one, which was developed by the American CDC, or Center for Disease Control, came out in 1999. And it is still today probably one of the most widely used. Even though it's set in America, it's still one of the sort of most widely used frameworks. We'll talk through a couple of other local Australian ones as well, but I just thought I'd start with this one as it's sort of, you know, one that was developed early, and the use of it's been quite widespread. So with all frameworks, they like to put a nice visual, which is fantastic, and we'll talk through this a little bit more, but it's sort of, they see it as that sort of cyclical framework, so it's not, you know, a sort of step-by-step process, but more cyclical, and should, when you get to the end, you really should start again, is what they're saying within the program. So we look with starting with engaging stakeholders, and we'll work through these a little bit more, but then you need to look at what the program is, and this comes back to looking at those program objectives, and what are the outcomes that are required in the program, and what are you really looking at achieving. Then the evaluation then looks at what you want to evaluate within that. And again, looking back at those different types of evaluation, is it something that you're wanting to do prior, during, or after? Then gathering the credible evidence is obviously looking at that data collection and how to collect your data best, and we'll look at that today. Then interpreting your data and justifying your conclusions. So really that dissemination of information, and that feeds into that, ensure you use and share the lessons. So don't be those gatekeepers, get those reports written, change those practices that might have come back as unfavourable, and then you need to engage and share that with your stakeholders. So you can see how it ties around quite nicely. And sitting in the middle is really those quality standards and those quality assurances. So, you know, it needs to be feasible, it needs to be accurate, you need to have utility or universal sort of comprehension and understanding within all those points from all the stakeholders as well. So that's the CDC one. I'm just going to run you through a couple of more, and then we'll use a bit of a breaking down worked example of it to help. Okay, so this one is appropriate to you, Madeline. It's Victoria Health one, which is an Australian one. Again, sort of builds on some of the same concepts, but a little bit different. So these are the 5 steps, or 6 steps of EPUN. So you've got your describe the program, again, comes back to those objectives and goals and what you want. Then the evaluation preview includes engaging with the stakeholders at that point in time. Okay, so what do you want, where are you going, and who do you need to engage within that evaluation preview? The focus of the evaluation design then comes down to, again, what is the design? What are you trying to ask? What are your questions? And we'll nut this out a little bit more today as well. How do you collect your data? How do you then analyze and interpret your data and disseminate? So you can see similar to the CDC steps, but termed a little bit differently, but similar in terms of what they're achieving with the evaluation process. I'll be putting up these resources on in the weekly folder this week as well, so you'll be able to read and utilise these when you come to your projects as well. All right, so for working it up, I thought we have got an American example, but I thought it was just quite a nice, distinct example to give you. So what I will do is we can read through it, then I'll break you out into the groups. If you can access the slides that I popped up before, then you can refer back to it, because unfortunately with me breaking you out into groups, the downside is I lose my screen share for you to then continue to read the scenario to refer back to. But we'll go through it, and then I'll break you out, and then if you can pull up the slides, you can refer hopefully back to it yourselves. So basically, the scenario is that we had communities are continually seeking ways to reduce the impact of food insecurity and improve nutrition for residents. So that's a big public health concept that's absolutely worldwide, particularly, and it was Homelessness Week this week. I'm not sure if any of you guys were aware of that. So it's a big factor in Australia as well, and looking at affordable housing and food security is a massive public health issue for us as well. So in 2005, the New York City Department of Health and Mental Hygiene public health officers introduced a pioneering community-based program called the Health Bucks to the Bronx, Brooklyn and Manhattan areas. This food access initiative catered around coupons that were distributed to low-income New Yorkers via community-based organisations. So they're engaging community organisations, and it's a food coupon system. They could be used at any of the 11 participating markets. So it was actually for farmers markets for fresh food. So it wasn't to a store, and it couldn't be, it wasn't a system where they could go and buy other non-perishable items. I did it round the wrong way. After the initial program, Health Bucks was expanded in 2006, and they received SNAP benefits for electronic transfers and at wireless terminals installed at farmers markets. So it's still at farmers markets to really push that purchase of fruits and vegetables, but without the need for physical coupons. So people were losing coupons. It also featured additional financial incentives. So they recipients at certain markets could receive a $2 coupon for every $5 that they spent at the market. So in that way, it was a reinforcement. And the goal of Health Bucks was to increase the access to fresh fruit and vegetables by providing financial incentives for low-income New Yorkers. And it had to be at the farmers markets in low socioeconomic neighbourhoods. Okay, so that's the take on it. So the activity for today is what type of evaluation is required for the program. So if you think about those 3 evaluations that I talked about, and then also who are the key stakeholders. So there's a little table there for you to sort of nut out where you think the stakeholders might fit and who you could see working in. Now, even though it's an American example, I'm happy for you to build in what you think for local governments within New South Wales or within Australia, but so you could just transport that scenario, say, to Sydney or Melbourne and discuss around that. So I will now just exit out of my screen and I will pause the recording.